Hey friends, this is Dr. Brendan Cochran. I'm coming to you from Denver, where I'm teaching a class with my colleagues on the use of stem cells and nutrient therapy and also aesthetics to help turn back the clock so people can live to 139 years of age. One of the things I wanted to help you get educated on is the topic of stem cells. It's a very controversial thing, and sometimes it's like cowboy medicine out there right now. And I want you to be safe as the patient or the person that is receiving these things or thinking about these things. In my practice, I use them as simply a tool. I find that sometimes tools do create miracles in people, but it's like every other tool that we use in clinical practice. It has its limitations. So when we treat patients, when I treat patients, we get results, but then we find the longer you do this, the better the results get. So a lot of people will come into my practice and they'll say, oh, I've heard about stem cells. I think they're the miracle cure. I want to get one. Well, I'm going to tell you the likelihood of one is not going to quote, cure you or fix you of all your ailments, whether it be a pain condition, whether it be a chronic disease situation. We find in our clinical practice, like everything else, it's part of a broader overviewed package. So when I address a patient who wants to come in to get these so-called stem cells, I want to make sure to address their whole terrain. I want the body to be very, very healthy. Now, why is this? Well, one of the key things that I wanted to illustrate, everything out there right now that is called stem cells is not stem cells. If it's from bone marrow, if it's from fat harvesting, if it's from embryonic cord tissue, none of those are truly stem cells. The only true stem cells are out there is when you harvest material from a person to replace bone marrow, say in a leukemia procedure or lymphoma. Well, why? I just thought you said that bone marrow harvesting wasn't true stem cells. Well, let me explain further. The definition of a true stem cell is actually a cell that was harvested from the body in some way, and it's then manipulated, meaning it's expanded so those cells are allowed to grow, and then they're placed back in the body. Now, this is not a legal procedure in the United States unless you're doing it for leukemia or like lymphoma conditions. So think about that. When we take a tissue that is rich in cytokines, rich in other stimulating material, when we put that in the body, specifically, we're finding if you put it in areas called the brown fat, or if we put it in specific areas where you may have a complaint, it's a rapid activator of your own body's stem cells to generate. And that happens also if you're using fat or you're using bone harvesting. The problem with those two that I've often seen is we're harvesting that type of material or those cells from a very old individual, right? So that means your material's not that active. So I'm going to inject you with that, and I'm not going to have as strong a response at stimulating your own stem cells to turn on. Now notice the key word there is I'm stimulating your own stem cells to turn back the clock or to help reverse things. If you do a therapy, but maybe you don't continue a therapy, so maybe you want to be proactive and I want to slow down aging. If you think one's going to do it, it's not, because your cells are going to continue to die. So it's this fight against stimulating them enough that I can stimulate enough growth, but also fight that death phase of my own natural cells. So we see that a lot of our patients that want to do maintenance will do this procedure either quarterly or bi-yearly. Personally, I use them a couple times per year, even quarterly now, so that I can feel the best I can feel, and I'm slowing down aging. If we have a joint complaint, like a bad knee, depending on your age group, so if you're young and vibrant, probably not going to need that, right? We could use another therapy like ozone or like PRP or PRC techniques to stimulate your body to repair itself. If you come in though and you're in your 60s and that knee is really bad, it's like bone on bone, you're having excruciating pain, you're trying to learn something else before I go in for surgery, a better option is likely going to be using biological allografts. You're going to get faster results. You're not going to have to be poked 8 times with ozone or PRP. So that's my decision process when I'm using things like biological allografts. So this is really important language, especially when you're talking with your friends or your colleagues. Better terminology is biological allografts. That means it's a tissue that's activating your body's own stem cells. It's not truly stem cells. And this will help make the area of, quote, stem cells a little more refined, and you actually have an understanding too of true material, because right now we're kind of in an age where it's all over the map, and I've heard even bad things where some salespeople are out there, and we do this in everything. We see salespeople selling medical equipment, selling surgeries, but they're doing the same thing. They're actually manipulating some of the material, and you're not getting the purity and the potency of material that you would want in your body. Good to see you. If you like this video, you want to hear more, hit the like button. Put some messages down there. Say, hey, I want to learn more about this. All right, guys, have a good day.